Hello, so very good morning to one and all. I'm Dr. Shrutika. I welcome you all back to our new YouTube video today. So from today's YouTube video, we are starting up with a series of views of Hahnemann on case taking. Hahnemann sir, Dr. Hahnemann के guidelines क्या दिए गए हैं with respect to 6th edition of Organon, जो aphorism number 83 से लेके aphorism number 104. Starting from aphorism number 83 to 104, what are the different guidelines given by Dr. Hahnemann in case taking? We will be learning this into this series of case taking. So let's get started. Now, introduction. So, in Medicine of Experience, that was written in 1805, Dr. Hahnemann has described the method of investigation of a sick man, and thereafter, in almost each edition of Organon of Medicine, he has progressively unfolded the methods of knowing the patient. It is imperative for homeopathic physicians to understand and implement those instructions given in aphorism number 83 to 104 in Organon of Medicine to be followed. So, case taking के जो aphorisms का group है, it starts from 83 to 104, in which Dr. Hahnemann has given all the necessary things related to case taking. So, what is given in aphorism number 83? So, it is individualizing examination, this individualizing examination of a case of disease, for which I shall only give in this place general directions, of which the practitioner will bear in mind only what is applicable for each individual case. Demands of the physician, nothing but freedom from prejudice, sound senses, attention in observing, and fidelity in tracing the picture of the disease. Now, what is the definition of case taking given by Dr. Hahnemann? It is individualizing examination of a case of disease. Okay. And what are the four most important points given in aphorism number 83? That is freedom from prejudice, sound senses, attention in observing, and fidelity in tracing the picture of disease. Now, in the upcoming slides, we will understand in deep about each point what Dr. Hahnemann wanted to emphasize on. Now, first is the freedom from prejudice. Now, what is freedom from prejudice? A physician should not have prejudice. Prejudice मतलब क्या कि कोई preoccupied idea, कोई preoccupied चीज पेशेंट के बारे में, केस के बारे में, डायग्नोसिस के बारे में, पेशेंट अपने पास आने से पहले, क्लिनिक में आने से पहले कुछ मन में होना नहीं चाहिए. If we are having any biases in our mind, that is prejudice. ये पेशेंट ऐसे ही है, ये पेशेंट वैसे ही है, ये मन में पहले होना ही नहीं चाहिए. So this is what Dr. Hahnemann wants to say from freedom from prejudice. So a physician should not have prejudice regarding the process of studying the case, diagnosis, interpretation, processing of data, and prescription. Every case should be studied from all the angles. A physician should not use his own parameters to understand the case. For the time being, he should detach himself from his own past experience, his emotions, desires, aversions, and physical reaction. So whenever we are taking any case of a patient, we are expected to detach ourselves from the all past. जो पहले हो चुका है, मैंने ये केस पहले देखा है, मुझे इस टाइप के केसेस में अच्छे रिजल्ट आए थे ये मेडिसिन से, तो आई विल ट्राई दिस मेडिसिन इन दिस पेशेंट. नो, this is being prejudiced. So ये नहीं करना है. So we should detach ourselves from our own past experience. We should not keep any emotions, desire, aversion, or any kind of physical reaction when we are taking the case of the patient. In a word, first, he should be detached from his own self, and then he should try to understand a patient. अगर हमें patient को समझना है, to understand the patient as a person, as a whole, we should first ourselves detach, खुद को पहले detach करना है from our own world that we are living, and we then have to be unprejudiced and take the case of the patient. Only dedicated physician can achieve it through strong commitment and constant practice with a desire to serve the fellow being. We say consistency is the key to anything. The same applies over here. If you will keep doing, keep taking cases of patients every day and night, every day आप cases ले रहे हो, तो naturally वो constant practice हो जाती है, and you naturally have that inclination की strong desire, commitment build up हो जाता है. Okay. Now, freedom from prejudice के बारे में, what has Dr. Kent's comment? Dr. Kent, while commenting on an unprejudiced observer, writes, it would almost seem impossible to find at present time one who could be thus described, all men unprejudiced. मतलब क्या कि it is impossible to find such a person who is unprejudiced, who is not having anything at present on his mind, because we all are prejudiced. The only way to become unprejudiced is to become aware of our prejudices. हम unprejudiced तब होंगे जब हमें हमारे prejudices पता है. Once we know our weakness, our emotions, our mental and physical reactions, we can be aware of ourselves in a better way. This would help us to understand and interpret the patient's reaction. पहले patient को समझने से पहले, we as an individual, as a physician, we should understand कि मेरा क्या weakness है, where are my emotions, what is my mental or physical reaction. Only then we can understand and interpret the patient's reaction in the most correct manner. Going up ahead, common prejudice which group up during an investigation. So thermal reaction, likes and dislikes, emotions or reactions at the mental plane, similar unresolved situations. तो ये तो पेशेंट ने अगर कुछ बोल दिया, नहीं दिए तो फिर चिली है, ये तो फिर हॉटी है, ऐसे नहीं करना है. इस अगर कुछ बोल दिया मुझे स्वीट पसंद है, हाँ ठीक है, पेशेंट को स्वीट पसंद है, उसको स्वीट की क्रेविंग है, ऐसे नहीं. You have to go into detail and ask it properly, and then only conclude what is the desire or aversion or dislike of the patient. Okay, going up ahead. Prejudices arising from. Prejudices physician के मन में, हमारे मन में, whenever we are sitting and taking up a case, what prejudice, किधर से आता है ये prejudices? Successful experience of similar clinical condition, limited use of specific group of medicine, and knowledge acquiring from study of materia medica and therapeutics. Diagnosis, similar physical makeup and bodily reactions, similar habits, his experience of life and living. ये सारी चीजों से प्रेजुडिसेस आते हैं. अगर कोई केस हमने पहले सिमिलर कंडीशन का देखा हुआ है, हमें सक्सेस है, चलो मैं यही दवाई दूंगा, नहीं करना है. लिमिटेड स्पेसिफिक ग्रुप ऑफ मेडिसिन का ही नॉलेज और थेरेपेटिक्स पे ही मैं दूंगा, ऐसे भी नहीं करना है. और कुछ हमारा पास एक्सपीरियंस है उसको अप्लाई करने की कोशिश, बिकॉज वी बिलीव इन इंडिविजुअलाइजेशन. whenever we say our prescription is holistic, to label our prescription to be holistic, the case taking should also be in holistic approach. Going up ahead, second point that Hahnemann mentioned was sound senses. So we notice any change with the help of our sense organs. Now, what are our sense organs? It is the eyes, nose, ear, mouth, tongue, and skin. So these sense organs have been mentioned. Hahnemann's words, be his powers of penetration ever so great, takes note of nothing in every individual disease except the changes in the health of body and of mind, which can be perceived only through senses. So senses can be called sound if the mind can employ them to their best capacity. In order to obtain a complete picture, one has to now what to notice and where to look for in a given case. So जो भी case हम ले रहे हैं, we have to be very accurate. हमारे सारे sense organs, we have to see the case, we have to hear the case, we have to observe, or using all our sense organs, we have to perceive the patient as a person to form the complete picture of the case. ये है sound senses. Going up ahead. Sound senses not only help the physician to receive information, but also be discriminate and differentiate. A physician's senses can be called sound if he is capable of utilizing them in an undisturbed, uninterrupted, and unbiased way. Like we have said ahead, said in previous, being unprejudiced is being unbiased. Soundness of senses also develops on the sensitivity and commitment of the physician to his profession. Whatever may be his knowledge in the subject, if he is not sensitive and committed to the service of his fellow beings, his senses might fail to form an accurate picture of the disease. So commitment of the physician to his profession is very much important. If the physician is not sensitive enough or not committed enough to the service, then जो भी criteria है to be unprejudiced, sound senses, ये नहीं achieve हो पाएगा, will fail somewhere. Now the third point that Hahnemann mentioned was attention in observing. A physician should be able to focus his full attention on observing the facts and phenomena of disease. A true observation cannot be done without prior attention. While taking a case, he should concentrate on observing the patient alone. As a matter of fact, many psychologists have experienced their opinion that one cannot attend to be more than one work at a time. If two things are attended together, one gets unattended. So whenever we are taking the case of the patient, हमारे मन में कोई दूसरी चीज नहीं होनी चाहिए. और यहाँ पे मैं अभी न्यू पेशेंट है तो मैं उसका केस ले रही हूँ, साइमल्टेनियसली मैं फोन पे बीच में बात कर रही हूँ, मैं फॉलो अप ले रही हूँ, साइमल्टेनियसली आई एम टॉकिंग टू द रिसेप्शनिस्ट एंड टेलिंग हर टू मेक दिस मेडिसिन. ऐसे नहीं करना है. whenever we are taking the case, her full attention has to be in case taking only. We have to understand the patient. Duty of the observer is only to take notice of the phenomena and courses of the disease. His attention should be such that nothing which is present would escape his attention. Whatever is presenting, nothing should be skipped or nothing should be left. कि अरे ये पूछना भूल गए, अरे ये पेशेंट ने बताया था मैंने लिखना भूल गए. ऐसे नहीं होना चाहिए. Whatever has been expressed by the patient, it is to be mentioned. Going up ahead. Attention in observing. Attention is required in observing so that what he observes is understood exactly as it is. It must be chiefly acquired by practice, by refining and regulating perception of senses. Master Hahnemann, in his essay Medical Observer, writes, true it is that the careful observer alone can become a true healer of disease. He delineates a few points in favor of observation. So, the medical practitioner requires possessing the capacity and habit of noticing carefully and correctly. जब आप continuously वो practice में हो, cases देख रहे हो, patients देख रहे हो, you are dedicating your time to your clinic, to your practice, वो आदत बन जाती है. It comes into your habit. And then you become a careful observer, and then is when you can be called as a true healer of disease. Going up ahead, he should direct all his thoughts upon the matter in hand and should come out of his shelf. Great patience supported by power of will should sustain him. Going up ahead, the best opportunity for exercising and perfecting our observation faculty is afforded by instituting experiments with medicines upon us. He must restrain himself from poetic fancy, fantastic wit, speculation, overstrained reasoning, forced interpretation, and form a tendency to explain things. ये तो सबसे बड़ी बात है कि फोर्स्ड इंटरप्रिटेशन. हाँ, मतलब पेशेंट ने ऐसे बोला, मतलब उसको ऐसे लग रहा होगा, ऐसे उसको क्या लग रहा है हमें इंटरप्रेट नहीं करना है. वी हैव टू राइट व्हाट इज said by the patient, possibly into the patient's own language. Patient बात कर रहा है into his mother tongue, we are trying to write it into English में लिखने की कोशिश करें so that we can convert that thing into rubric. No, this is wrong. We have to write what the patient is saying and not what we feel. ये इंग्लिश में इसका मतलब ऐसे होता है तो अभी मैं ऐसे लिखती हूँ, ऐसे नहीं होता है. So this is what Hahnemann is trying to tell. Now, fidelity in tracing the picture of disease. Now, a physician should be able to translate his observation into words by using the most appropriate expressions, intensity, circumstances, association, and other details of all expressions must find a place in the record without changing of all expressions. Must find a place in record without changing its meaning. So whenever we are trying to interpret our observation into words, it should be the most appropriate expression. जो जिस इंटेंसिटी से, क्या सर्कमस्टेंस से पेशेंट ने वो एक्सप्रेशन दिया है, the meaning of the expression should not change while we are interpreting it. What is being said by the patient is to be taken. Notation should be candid and in the patient's own words as far as possible. So, the physician who appears vague, impatient, bored, or insensitive will not be able to show his exactness in eliciting, detecting, or forming a true portrait of disease. Hence, it is imperative for an homeopathic physician to have fidelity. What is the meaning of fidelity? The meaning of fidelity is to be loyal, to be true, to be committed to our work in tracing the picture of disease. So जो भी patient बोल रहा है, it is to be written as far as patient's own expressions. So फिडिलिटी का मतलब क्या है कि जो पेशेंट बोल रहा है उसको लॉयल्टी से, ऑनेस्टी से पूरा अपना माइंड उसमें डेडिकेट कर देना है. व्हेनेवर वी आर टेकिंग द केस, नथिंग शुड बी ऑन आवर माइंड, इधर क्या चल रहा है, उधर क्या चल रहा है, इधर के no thought. You should be in sync with the patient over there. Only then that energy will match and the case taking would lead to beautiful homeopathic results. So ये वीडियो में हमने क्या सीखा? This was the first part of the series of case taking. What are the guidelines given by Dr. Hahnemann? So जिसमें हमने aphorism number 83 देखा, and then freedom from prejudice, sound senses, attention and observing, and fidelity in tracing the picture of disease. ये सारी चीजों को हमने डिटेल में समझा. So if you find this YouTube video useful and also the way of teaching, now I have changed my way of teaching from pen and paper to PowerPoint presentation. You can also see this change if you scroll down to the previous videos. So you can comment me and tell me your suggestions, your queries. And to know more about me, you can follow me on Instagram by the name Dr. Shrutika Sanjay Dhavane. You can also listen to my podcasts by the name Homeopathy Talks with Dr. Shrutika. So keep learning, keep sharing. So our whole aim of this series is to make education or understanding of things easy. हमें कोई चीज रटनी नहीं है, रटने से वो ज्यादा टाइम तक याद नहीं रहेगी. अगर आप उसको समझ के लोगे, कंसेप्ट आप समझ जाओगे, then it is not difficult for you to write it in paper or to implement this in your practice as well. So याद रखी हुई चीजें भूल जाते हैं, समझी हुई चीजें हम भूलते नहीं है कभी, ये याद रखना है. So if you find this YouTube video useful, do not forget to subscribe, share it amongst your friends, So keep learning, keep sharing. Thank you and have a nice day.